The title of this series is Walking in the Wilderness, Growing Through Mental Health Challenges. And we're going to really get into the weeds in this, but today will be an overview of looking at the situation of mental health crisis in our society and particularly in our community. The 4-week series will include today's session, the intro. Next week, we'll have a session that focuses on trauma, personality disorders, and behavioral change, and how does spirituality and mental health fit together. And then the third Sunday on the 10th will be a mental health time talking about youth and children and dealing with that kind of situation in our community. And then the last Sunday on the 17th will be some personal stories, and all of these sessions will have lots of Q&A. So please don't hold back on your questions, and we'll do our best to answer those. This is a huge topic that must be addressed in the church. As most people know something about the effects of mental illness in their families. I might better say, as Danelle taught me, mental health challenges, right? It's hard to talk about sometimes because nobody wants to be interpreted as being weak or crazy. And this is, in a real way, the elephant under the rug in our families at times, in our churches, and in our society. My personal experience and why this series is there's been a lot of mental health challenges in my extended family going back generations. We'll get into that in week 4. And in my immediate family, there's been some situations that we'll talk about in week 4. And I personally, I call it preventative mental health, have been in therapy over 42 years because I didn't want to make mistakes I've seen in my upbringing or in my history. So I said, might as well get a handle on it early. And that started in my first year of marriage, by the way, just so you know. So thank you for being here and in these weeks, and feel free to invite others. It's a topic, again, that we don't deal with very often, so this is really important. Thank you for being here. I'm really happy. And just so you know, we have some flyers, and Danelle will talk about the brochure that today we brought Heartland Mental Health, and they're going to talk about some things. And there's a table in the back. You could pick up some things. We have some NAMI handouts and some other handouts. Feel free to take those. Join me today in welcoming our neighbors from Heartland Mental Health, which is a nonprofit community mental health center in the Capitol Hill area of Denver. My wife and I had the pleasure of visiting last week. It was wonderful. Had a great time. The mission they have is to transform lives by providing supportive, member-centered, culturally responsive services for mental health, wellness, and recovery. The people that will be here today include David Barnes, who you'll hear from in a minute, who's the executive director with Heartland. Danelle Herra here is the community outreach manager and peer support specialist. And then joining them today are two members of Heartland's member board of directors, Karen Ackerberg. Did I get it right, Karen? Okay, close. And Aaron Williams, and they will share with you some things that I think will be extremely helpful. So please welcome them.
Good morning. I haven't been in a church in a while, so please give me a little bearing because I've grown up in a church, in a Baptist church, and most of my family were pastors. My mom was like an evangelicist type person, so when I didn't go, I had to do a lot of extra chores and stuff. So I think when I get back home, I might have to revisit some chores from my childhood. Danelle told me to hit the arrow, that's me. And I had the same T-shirt on, so I don't have too many T-shirts that I really like, so I like this T-shirt. So thank you for allowing us to come here. You guys have been funding us, too, over the course of the last few years with some of our programming, and we really appreciate the support you guys have been giving us. And if you didn't know you've been funding us, now you know. We have two different type of programs at our facility. One is more of a typical program that you would probably see in a lot of different mental health clinics. We see patients, we come and do an intake on them, we do an assessment with them, and then we try to provide them services. So it's kind of a layered approach, and the patients typically come in our office Monday through Friday. We're open from 9 to 5. Sometimes we do it telehealth, where they can do it over the phone primarily. Not too many people do the Zoom thing with us, but that's also an option if they have the capacity to do so at their home. And that's kind of a typical clinic kind of setting, but I will say we're not typical because in the community base that we serve, we get people in a pretty fast basis. Some of the bigger organizations that I've met since I've moved here, their waiting list can be up to 2 to 3 months, and we try to get people in within a month's time frame if possible. So we have therapists there, we have a nurse we're hiring for now, psychologists, psychiatrists, we're hiring a different kind of format now, bringing in different personnel to administer medication, which almost 90% of the people that we do use medication. So from the standpoint of when somebody comes in to when somebody gets seen, typically it takes about a month, and from that standpoint on, depending on their level of therapy, they can come in once a month or up to 12 times a month. So it's just depending on where they're at in a layer of how we need to help them. Then the other kind of facet of what we do is we call it peer support, where we have a drop-in center and we have people who participate in that particular environment that gives them more stability in kind of doing their daily functioning. So you have peer support specialists like Danelle who assist people also in that particular portion of our agency to kind of combat things that they're going through, but they also have the engagements of other people that are there. And that sometimes breeds about kind of more of an extra layer of support. Dealing with mental health, I think a lot of times people look at it as a stigma or don't understand it, but a lot of times people are just functioning with that particular disorder or challenge the rest of their life. And what we're trying to do is help them maintain that lifestyle, which is very productive, because sometimes you're just going to be that way. Going back to my religious days when I was with my mom and going to church every Sunday and all that fun stuff and always dealing with poverty, my mom said to me, "David, do you understand the meaning of poverty?" I was like, "People are poor." She said, "No, what does it say about it? Poverty in the Bible. Poverty will always be with us, right? So mental health challenges will always kind of be with people who have those. So it's how you adjust and help people out on a daily basis is kind of what we do. So it's not to the facet of people saying that we're going to just take away their mental illness. I mean, just life does not happen that way. So I think we all have to get under that kind of auspice of what it really means. So back to the programs that we have, when people are a part of either the peer program or the clinic services, they can interchange. You could be a patient, you could also go to the drop-in. And another part of our program is that we hire people that are peer members. So to be in that peer support program, you have to have a mental illness diagnosis. And then the programs and the activities we run are throughout the week. Basically, the lunches and the food that we provide, it's only like $1 for like a lunch. So it's very cost effective for people to come. But more important than the activities that we do and trying to get people to come in and engage in people, engage in activity, I should say, is actually just being in the room with other people. And I think that sometimes goes under the auspice of what really it's all about. And I think that's really kind of the way it runs, really fluid. But the peer employment program that we do run is we hire people primarily for our receptionist duties and also for like janitorial duties. So that's kind of the whole umbrella of what we do. We only serve adults, 18 and older. People have to have insurance to come through our facilities. We do have some grants that allow a little flexibility with that to a certain degree. But typically, once you get into our program, you can be there for as long as need be. And we service people. I was looking at some data, statistics of what we do for a grant, but we service people that are 2 hours away. So people come in 2 hours away for our agency. We've been around for over 35 years. So the longevity and what we've been doing is kind of world heard, especially in the Denver area. So I'm very proud to be working there. I'm very proud of the people that we work with us too, other community members, and also with our staff. I'm not sure when you're going to do a questioning thing part. I'm just going to turn it over to Danelle right now. All right.
All right, so I'm just going to go over a general definition, a few mental health statistics, a few myths are associated with mental health if we have time today. What can we do? There is a crisis in our Denver metro area, and then I'll turn the time over to Karen and Aaron to share some of their stories, and we will leave some time for question and answers at the end. So as Dr. Brennan and David mentioned, a mental health condition really impacts people's day-to-day living. So it is something that affects the thinking, feeling, behavior, or mood. Obviously, we all experience things that affect our mood, but it's really when it affects the ability to relate to others or day-to-day living that it can be a mental health condition. This isn't the result of one event. There's research that suggests it's linked to multiple different things, such as genetics, environment, lifestyle, trauma, stressful events, brain chemistry, the use of drugs and alcohol can impact it, as well as just unhealthy habits, such as not getting enough sleep. Sometimes that can also affect our mental health, right? So some statistics here in the United States, there's actually 1 in 5 people who experience a mental health condition each year. So that is at least 20%, depends on what year you're looking at the data. It can be up to 20 to 23% of the population. 1 in 20 people experience a serious mental health condition each year. 1 in 6 youth aged 6 to 17 experience a mental health disorder each year. Suicide is the second leading cause of death among aged 10 to 14, and over 7% of adults in the U.S. have a co-occurring substance use disorder and mental health condition. So the statistics, it is pretty common here in the U.S. Maybe some people aren't aware of it, but just wanted to let you know if you have a mental health condition or if you think you might have one, you're not alone. The statistics show it is pretty common, even if we're in families or communities that maybe don't talk about it quite as often, it is fairly common. Just to show the prevalence of a few different mental health disorders here in the U.S., if you look at the last two, depression and anxiety, it's over 8% and over 19%, so these are both pretty common as well. Here in Colorado, the statistics aren't great. According to Mental Health America, they do studies quite frequently, and they'll put out reports, I believe it's each year. So Colorado ranked number 45th in the nation, so 1 being one of the best. So we're pretty low as far as compared to some other states. And the measures that they used are up here in the adult ranking. So that's adults with any mental health condition or any mental illness, adults with a substance use disorder in the past year, adults with serious thoughts of suicide, adults with any mental illness who did not receive treatment or reported an unmet need, who are uninsured, or adults reporting at least 14 days or more in a month who could not see doctor due to cost. So these are the factors that they used the ranking. Here in the Denver metro area, the Colorado Health Institute, as well as the Denver Public Health and Environment, they do behavioral health needs. So the last report that they put out recently in 2021, over 110,000 Denver residents needed mental health care but did not receive it. Over 11,000 needed services for substance use but did not receive any as well. So over a third, they asked in the report and the health needs assessment, 1/3 did not receive care because they didn't want to talk about the personal issues. That was some of the reasons about seeking care. So you can see 1/3, that's a pretty large percentage who is still kind of uncomfortable talking about it with maybe their primary care physicians or other people. A few of the myths out there, just wanted to address. Mental health issues can't affect me. I think a lot of people may have experienced this at some point in time, but like I just mentioned, 1 in 5 adults do experience a condition, a stressful job, or potentially traumatic event, or similar to physical health, you can develop conditions right later in life. It's not always that if you don't have one in the beginning, you never will. So sometimes it can affect more people than you might think. Children don't experience mental health issues. This is another myth. Half of all mental health disorders show in the first signs 14 or younger, and then 3/4 actually present by the age of 24. So again, 25% still develop it after the age of 24, but our youth and adolescents, it is common, and that's when you first start seeing signs. Another myth, mental health issues are a result of a weakness or character flaw, and people just need to snap out of it. Maybe they're not trying hard enough. There's a lot of studies and research that, mental health conditions don't have to be due to weakness or laziness or anything like that. There's a lot of biological factors, and sometimes there's physical illness or injuries or different brain chemistry. Life experiences and family history can also contribute to it. Another one out there, only people without friends need therapists. This is a big myth as well. There's a big difference between therapy and speaking with friends. Obviously, both can help in different ways, but a trained therapist can address issues constructively, and they might have tools and techniques from their training that your friends and mentors might not have. So obviously it's helpful to talk to other people as well, but it can make a difference to talk to a therapist. And some people have a hard time opening up with their friends and family. It doesn't mean that they don't have a network, but the therapy is confidential and it's objective and focused on the individual. Another myth, I can't do anything for a person with a mental health issue. So friends and family can do a lot to make a difference. Now, obviously, a lot of times there is conditions and people that do need to seek professional help. But friends and family, if you are somebody who is supporting somebody, you can let them know you're available to listen or talk. You can help them find access to mental health services. Like we mentioned, there'll be some brochures for Heartland Mental Health in the back, but there's also websites. They can talk to their primary care physician. You can talk to your insurance provider. There's and see what's within your network or within their network, helping them learn some self-care or coping techniques. There's also learning the statistics of what we shared and helping them know that they're not alone. Obviously treating them with respect, just as you would anyone else, but also refusing to define them just by their diagnosis, right? Another myth, there's no hope for people with a mental health issue. Once somebody develops it, they will never recover. As David mentioned, there are chronic conditions that you can recover in a point of more stable and maintaining a productive and happy life, but some conditions are kind of chronic. But some people do recover. It depends on the condition and their journey. So SAMHSA, which is the Substance Use and Mental Health Services Administration, defines defines recovery as a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. So recovery does mean different things to different people. That's one of the definitions out there, but it is highly personal, and so it could include clinical treatment, it could include medications, it could encompass faith-based approaches, peer support, family support, self-care. There's a lot of different ways out there. So some of the four major dimensions of recovery too, I'll just briefly touch on these. In addition to those, health, home, purpose, and community make a big difference. David mentioned community. Really being part of a community is a big deal in addition to home and purpose. So what can we do? A few things that we can do is, prioritize our own mental health and physical health. I do think that I like to use the analogy that they use on the airplane. You have to put on your own oxygen mask first before helping others. If you're depleted yourself, it is hard to help your friends, your family, your community. So it does make sense to go ahead and, take care of your own health. A few different ways, exercise, eating well, getting enough sleep, trying to practice gratitude, staying connected with others. These are some things that you can do. Again, we can seek professional help. There's a few different signs or symptoms out there that you might go ahead and want to seek help. If you're really having a hard time sleeping, your appetite changes, concentration, you lose interest in the things you typically find enjoyable, and just things that are really impacting your day-to-day life. So there are different types of professional help out there, like we just mentioned. All right, but what can we also do as a community? I really think it's important to talk about it openly. Dr. DeBrun mentioned that there's still quite a bit of stigma out there, and people do feel alone, and sometimes they aren't comfortable talking about it. So the more we talk about it and share our own stories, it does make a difference. If anyone's interested, there are mental health first aid trainings out there, and this isn't just for clinicians. It can be for anyone who's just interested in learning more about mental health and understanding and responding to signs of mental health conditions. It is an 8-hour training, just letting you know, but there are websites, and if you Google mental health first aid training here in Colorado, you'll find some resources. And then again, we can share our own stories to help others not feel alone. So having said that, I'm going to turn the time over to Aaron next, and then Karen after Aaron, to share their stories, and we can have some Q&A time after that. So Aaron, if you want to go ahead and grab the microphone.
Hello? Oh, good, it works. The statistics that Danelle showed you is something to be sobered about. One of the things that I would like to discuss with you today is the culture of denial. We in this society are afraid of our own shadow in a way. And a lot of people don't know how to deal with the coming to terms with your mental illness. It's really costing us. I can't think of any time more than on the news when I hear stories about kids and guns. I just think that those two things really don't need to occupy their world right then. And when I was young, I ended up with a anger issue, and it was about 13 years old, and I ended up getting into a fight with one of the neighbor kids, and that's when the first time when my family figured out that I had anger issues. Now, my father was totalitarian man. He didn't much want to admit that he might have a mental illness. and consequently, we all suffered under his denial. But the good thing is that my parents decided to get me help. And for the first time, I was able to see myself as not something that I despised anymore, but more of being a human being again. They took me to a therapist a couple of miles away, and to tell you the truth, the man was just like a neighbor or a brother. He was so able to talk to me and make me feel at ease and help explain some of the craziness that goes on in my family. I didn't have any other way to relate to it. And when I went to his office, I knew that I was going to have a very positive person on my side who could help me take the issues that I was dealing with and sort through them one by one. He was such a patient man. He really was. And I admired that about him the most. But in my life, I guess I got lucky with them deciding to get me a therapist. But, you know, there are thousands of people like me out there who deserve to be heard and understood. And that's the one thing that I can say that I came away from this with was understanding. I understood that I was a unique person and that I was worthy of good things to come. And so I'm grateful for my family that they decided to get me some help soon. And I've been at Heartland now since '06. And so I've had plenty of time to get adjusted to my medication. I usually take, now I'm blanking on the medicines, amlodipine and Zoloft. And I take that twice a day, and that gets me the coverage I need to be okay with myself throughout the day. And at first I was a little hesitant to take medicine, and that went along with this idea of shame. Oh, it's a shame to have a mental illness, and oh, you should be afraid. And it's not that way, and I'm grateful that I don't have to sludge through it like I did when I was a kid. It comes pretty easy to me now. But what I want to communicate with you all today is that with proper mental health treatment, it should be just like brushing your teeth, something you do without even thinking about it. And there's help out there for anybody who wants it. And I think that's the message I'd like you all to carry today, is the knowledge that there are people out there that do care and that would like to lay the foundation for someone who doesn't understand right now where they are or what they need. So, yes.
Thanks, Aaron. Karen, do you want to go ahead and share your story?
Hello? Oh, okay. Yes. I have been with Heartland. It used to be called Charge, Capitol Hill Action and Recreation Group. But to back up a little bit, before I knew them, I was helping my mom. I was living at home with her because she was a senior citizen and visually impaired, and so I wrote checks for her and drove her to the doctor and everything. So I was trying to get a job, maybe part-time, so I could keep an eye on her. So there was a church there, Catholic Reform or whatever, and they had a nonprofit arm which helped people get placed. So I was interviewing with the lady, not making any sense to her at all. I was going, oh, what a wonderful day. Oh, I wore the wrong shoes. Oh, my skills are such and such and such. Hey, that's really a pretty vase you have on your desk. And so it was word salad, and she was going, I'm not qualified to help you, she said. So, I couldn't get her connected. I couldn't connect the words. All the words in the paragraph were unrelated. So I went home. I was just full of anger. When I was working too, like Aaron said, I had an anger issue, and so I would work part-time and then come home and yell. But later on, I was trying to get a job through this church. And so by and by, I was scheduled to be resident at Samaritan House, and the psychiatrist there said, "So Karen, how's it going? What's going on?" I said, "Oh, I don't think I have any condition at all." He says, "Well, we can agree to disagree." So when I was looking for jobs through there, they have a good program at Samaritan House where you can apply for jobs, send the resumes. Nobody was calling me back. No employers were impressed with the word salad on the phone. You know. So what was I going to say now? I can't remember. Oh, yeah. So I got prescribed with risperidone because they have a post-traumatic stress disorder. And it's also a medication for other conditions as well. And he said, "Okay, you have that too." And I said, "I don't know." And so the second psychiatrist I had through Heartland, said, "I don't think you have that condition, but you do have PTSD." I said, "Thank you, Lord." So, not that if somebody has multiple conditions that there's something wrong there. I just lucked out for some reason. Yeah.
And what do you think has made a big impact kind of the last few years too in your mental health?
With Heartland, yeah. Well, someone at the Coalition for the Homeless suggested go to Charge. There's a good clinic to be associated with. You get socializing with everybody, and just you won't feel like you're the only person. You won't be alone. So I hooked up with them in 2012, and I've been with them ever since. And I was able to acquire some job skills and continuity and consistency, so that I take minutes as a secretary. I've got a college degree in business. I never became CEO of someplace, but they have used my management skills and talents in the board. So,
wonderful. Thanks for sharing, Karen. I'll go ahead. Oh, yeah, go ahead, Aaron.
I neglected to say it at first, but I really owe my good mental health to God. And every day that I walk, I know He's with me, and He sees what I see, and He helps me through the difficult times. He really does. So.
Thanks, Aaron. I'll go ahead and share my story as well. I am one of the peer support specialists at Heartland. So a peer support specialist is somebody with lived experience managing mental health conditions. So I have depression and anxiety disorders diagnosis. I've been managing those both for years. I will say that when I was pretty young, even before high school age, I was pretty depressed. In high school, I had a lot of suicidal ideations and was really struggling. I feel very fortunate that I had a mom who I was close with and I opened up with, and she listened. She wanted to get me help. So I did feel fortunate at a pretty young age that I was able to see a counselor. In college, I did struggle still and have some challenges kind of in my college years. So I did go back and see another mental health provider. We did try medication, and it did make a difference. In my 20s, I moved out to California and was getting a lot of sunlight and fresh air and exercise and thought I was doing great. So, of course, I stopped taking the medications. And, it's a pretty common story. You hear people feel like they're doing great. There's a lot of shame and kind of like Aaron mentioned, I thought too, oh, well, I don't want to be on medications. Maybe there is a lot of people who have a fear of this. So I would go on and off for a while and really did downward spiral, late 20s, early 30s. So I do feel gratitude for being able to be in a community and a support system that recognized I was struggling. I did, again, go back and see a mental health provider, and I do remember a psychiatrist kind of saying, you know, why do you keep going on and off and on and off? And we really talked about it a while, and so right now I did find one that really does make a big difference and has helped kind of stabilize me. And I think I made a lot of excuses. You know, I could work a job. I you know, had never had any significant trauma maybe in my life or certain things. So I kind of made a lot of excuses, but honestly in my 20s, I did use alcohol very often to cope. And so I did develop a pretty unhelpful substance use for coping, right? Obviously it wasn't coping, it was just detaching from a lot of the stress that I had. So in the last few years, I realized moderation wasn't for me. I really did need to take my health more seriously. So I've made a lot of lifestyle changes, talked to a lot of people. I've had mental health providers that it really has made a big difference in my life, the multitude of things, right? So the medication, the therapy, having a community, a support system, focusing on my own health, and for me, living a sober life has also helped me. So I've been grateful to also be part of Heartland that allowed me to also share my own story and my lived experience and to help others kind of not feel alone, because I felt very alone for a long time. As much as my community was supportive, I didn't feel like other people kind of understood similar things that I was going through. So those are some of our stories, and I think did you want to share anything more before we go to Q&A?
You're forgetting to tell people that you're a base jumper.
I'm actually not a base jumper. I do a sport called speed flying. It's similar. So about 2.5 to 3 years ago, I had a very serious accident, and I almost died. I was in the hospital for a while. So it really did. I feel very fortunate for it, because it did kind of allow me to take my health very seriously, because before it I was very depressed and I wasn't really taking my own health and my mental health very seriously, and what I was doing wasn't working that well. I needed more help. I did need to go back and talk to more people. So yes, I talk about my accident a few years ago pretty often, because it was a pretty pivotal point in my life where I recognized I need more help. All right, I think we'll go ahead and turn the time over to Q&A. Yeah, okay. Oh, yeah, we have a mic. So if anyone wants to ask some questions, we can do our best to have some answers. If you guys want to share maybe some of these mics.
Roughly what percentage of your clients are dealing with an addiction? And when I use the term addiction, I go beyond substance use disorders.
That's a good question.
Grab the mic. David. They're doing a recording.
Good question. Typically, we don't deal with just substance abuse as a sole reason for coming into our clinic. We do have some people with co-occurring disorders, so you could have both substance abuse and also mental illness can be in our clinic or receiving services from us. I don't have a percentage of how many people would come in just for substance abuse that would come in, because we don't service just substance abuse in our programming. But we do have people who suffer from both. So we do have that. Now, the percentage of that, I don't know off the top of my head, but we do have documents as far as statistics for people coming in, the frequency, and if they are recovering from their challenges. And from that point of kind of what we're looking at, like we did a survey with 45 patients on certain topic areas, and 85% included out of that 45 survey that they are improving or maintaining their current lifestyle. So that was a good positive note, but we don't service just substance abuse as a sole entity, though.
Yeah. Hello. So first, I will tell a story, and then I've got a couple questions. But a couple years ago, I was also diagnosed with generalized anxiety disorder, and I was the last person I ever thought would sort of have anxiety. I was pretty chill, pretty relaxed, optimistic outlook on life. But something about, 3 young kids and increasing workload and a pandemic, right, will kind of do that to you. And so I spent a couple of years on an SSRI and certainly helped. And I think 2 things are striking to me about it. First is kind of just the knowledge that sometimes in life these things can come and go, right? So, once you have experienced this and kind of gone through it, you have just another tool in the tool belt. And so, right now I'm not on an SSRI, but I certainly expect in life that there will be ups and downs, and maybe as time goes on, I can go back to that tool. But the other thing I just want to echo is the importance of talking about it, right? Because so many people kind of in my age group, but probably in all age groups, are reticent to discuss this, particularly men. And, a lot of men in my situation who have little kids at home and stressful work lives, they don't want to talk about it. And so I've had conversations and have led to so many people kind of saying, hey, you know what? I feel that too, and I can go do something about it. So just wanted to share that story. I do think it's really important to be open about these things. So 2 questions. First, you had mentioned that you only take folks that have insurance with the exception of limited circumstances. So I'm wondering, what do the resources look like for folks who don't have insurance or can't attain it? And then my second question is, what is the prevalence of interactions with neurodivergence, ADHD and other things like that, and how do you see that kind of bearing into the mental health discussion?
First part for the insurance. Yeah, so most of the people coming through our clinic have Medicaid or Medicare as their primary insurance. We are opening our doors now to more private insurance. We do have a few insurance that use Medicaid as the main umbrella, but they might have a little bit maybe left over from a pension or something to that degree that will get some private insurance. People who don't have insurance, what we are trying to do now is work with the state to get them at least applications for Medicaid if they don't have insurance. So through Colorado Access, there's multiple locations people can go to fill out the applications if they have no insurance. So we kind of refer them to that particular entity to try to get insurance. Because when you come to the door, those are one of the questions that we ask. There used to be a grant that we had through the Homeless Coalition some years ago prior to me coming that would also refer people for specific reasons that they did not have insurance. I'm not sure if they're still doing that or not, but I know Colorado Access is kind of one of those hubs that helps people at least start the application process if they have no insurance.
First of all, I also just wanted to recognize, thank you for sharing your experience. I think that's wonderful that you're willing to share. Like you said, I feel kind of lucky that I'm a woman. I know that men, I do think in our culture it has, it's talked about even less, right? So I appreciate you sharing your story. As far as uninsured, we don't necessarily help at Heartland, but there are quite a few places that do. So if you go to findtreatment.gov, I believe it is, you can filter by if someone doesn't have insurance, there are places that either have funding that can help with it, or sometimes there's a sliding scale or different resources out there. So personally at Heartland, we might not be able to help as much, but there are places out there that people can find it. And then your second question, sorry, I'm forgetting now. Oh, neurodivergence. It's a good question. I know that a lot more of our younger clients, recent clients, since I'm not one of the clinicians there, I'm sorry, I can't speak a whole lot to it, but I do know there are more percentages that we've been seeing with ADHD or neurodivergence, but I'm sorry I don't have the specifics around it. There's another question over here. Sorry, just a minute. We have one in the back with the microphone. Sorry about that.
We'll bring you the mic. African American community have a lot of mental health issues and trauma. So my question to you is, and it's hard to find therapists that look like them, look like us. So what's the ratio and percentage of people of color that are therapists that work with you, and do you all work with Well Power at all?
Good question. We do have a multiracial component of people coming through our doors. African Americans were right around the 15-ish percentage of all the totality of people coming in for services. We also serve Latino, Native Americans. So we have a smaller population of those cultural groups that come in for services. We are trying to broaden the range that we can see more people that look like the community that we serve. I want that to also be known. Also, part of my job is not only coming to places like this, it's going to other venues that have populations of the people that live in our community that we can reach out to say, you can't come in. It is a misnomer in the community that if you're African American growing up, you don't need therapy. So I was in substance abuse counseling for so many years and seeing people that were affected by that particular problem. And I was from the city just like Denver, where primarily most people came to our doors were because they were forced to come in because there was some type of criminal kind of component to the reason why they had to come in. We don't really reach out to that particular entity all the time, but we used to have more affiliations with the police department, people on probation and parole, offices, things like that. That's another avenue where we're looking to get into our doors. We also, though, from the standpoint of what we're trying to do is having the capacity to serve people. I think that's sometimes a misnomer. We want to serve as many people as we can, right? But we don't want to be like some big places where they're going to have a 3-month waiting list too. You know, so we're also kind of like the more staff we get, the more funding we get, we can have more people that we can serve more people. You know, so that's also something that we're also looking at too. Is broadening our horizons, not only internally, but also externally, serving more of the people. Good question.
The question that I have relates to the word Healthland or Heartland. In other words, you've used that word, and I think it's appropriate. I come from a state that claims that it's a Heartland state, but tell us a little bit about how you arrived at the concept of Heartland.
Well, I know it sounds like the TV show, but there's everybody of every age on that show. I mean, and we're trying to appeal to all ages, all ethnicities, all, well, I hate to use the word races because people are going to say, oh, backgrounds, nationalities, you know, everybody's an American, you know. But yeah, I thought it was very, the reason why I think they picked the name is because it reflects the ideals of the United States of America.
Karen needs to take responsibility here. She was the one that came up with the logo.
Karen did
Yeah,
design the logo.
right?
A couple of years ago, we did go through a full rebranding and renaming process. So our clinic was actually known as Heartland Clinic for many, many years as well. So we did go through a few different names options, and people did feel like it reflected us since a lot of people already were familiar with Heartland Clinic.
I think, Danelle, well, I'll thank all of you for your presentation. Danelle, I was really struck by how low Colorado is in terms of being number 45. Do we know why that is? Is it a lack of services, or what causes that?
Good question. That kind of blew me away too, because I think of Colorado as, you know, a lot of outdoorsy people, you know, getting out in nature. And for me, that's a big component of my own mental health and wellness. I do think there's contributing factors. I can't say that I know them all. In some of the other areas that they measure are the youth statistics, and some of the other ones were probably in the middle. We're not necessarily the in the very bottom. I have heard that how our behavioral health system here in Denver area and Colorado is a little bit more disjointed than some other states, that sometimes it can be harder to navigate is what I've heard. I don't think the same levels of funding historically have been there. I do think they're really recognizing that, we need more help, and they are doing more kind of at a state and city level recently. But I think those are some components to it, but I do think there's other factors there that I might not, know all about it.
I'd like to just point out that a few years ago, we had a ballot initiative that we voted on that would separate tax out for mental health treatment. And that has been a big, big help to getting people in the doors. It's not perfect, but at least we're starting somewhere.
Yeah, I didn't mention that in one of my slides, but that's another thing we can do to help. So Mental Health Colorado and Colorado Coalition for the Homeless, both of those agencies do a lot of advocacy, and they'll talk a lot about bills that are coming up that have to do with mental health care. So if you're interested in kind of learning what bills are out there that you may want to support, those are a couple of websites that you can go and kind of read about it, and they have some ideas of how to get in touch with your legislators if you're interested in helping on that level as well.
Hi. Can you share the difference between Heartland and some of the other larger mental health centers like Denver Center for Mental Health, Jefferson Center for Mental Health? Most of the counties have large community mental health centers. Is it the funding or just sharing that difference?
So like Wellpower, Aurora Mental Health, some of the bigger entities around the area, some of them also provide inpatient services, so ours is all outpatient services. So our numbers are lower because we're a smaller clinic in the Capitol Hill area. Patient-wise, we're right around 60-ish people that are enrolled in patient services. The major difference, though, is that kind of drop-in kind of component I touched base on that Danelle talked about, that Karen and Aaron participate in. But also we have a two-board structure. Now, that might sound like more of a, internal how we operate. But what it does, it helps us with the decision-making of some of the programs that we offer and also some of the grants that we administer. Not most, but agencies like Wellpower, they're supposed to have a composite of their board that constructs the people that they serve about a 1/3 capacity. We have two boards that are all patient-driven, member-driven, peer-driven people. They help us in some of the decisions that we make. Our funding primarily is some state grants, but a lot of it is coming here. You guys give us funds. A lot of donations come through our door. And we do have a lot of support from a lot of other religious organizations. And also we get some grants that administer some of the programming specifically for our drop-in. So our clinic, we do get reimbursed from the state because of the Medicaid, Medicare, and some private insurance. So that funds a lot of the patient programming part. But for us to operate in the way we do right now, it's kind of like writing grants, foundations, things of that nature to kind of keep our doors open and keep on providing services. So our drop-in programming, it could range year to year, up to 200 people coming through the door. A lot of people come through our door primarily during the holiday seasons, things of that nature, but we have ongoing people that come in activities. Danelle runs an activity. Other people run activities that do special things that keep people engaged. So that's kind of the major difference that we do with some of the bigger kind of organizations that provide the same type of service.
Thanks.
There's another one over here. Yeah.
Thank you very much for this presentation. Since environment can have so much to do with, I think, behavioral health and mental health, I wondered what you saw the effects of COVID, and if there's kind of a long COVID that has extended over the years in increasing mental health issues.
I wasn't here, but I was in another part of the country, but I'll let these guys answer specifically because you're talking about Heartland.
Well, I don't know if I know the specific stats actually with Heartland, but just reading a lot of, in the news and keeping up with stats in general in Colorado and Denver and nationwide, definitely a lot more. You're right. The increase in, stress and the unknown and everything that we went through, parents, having to figure out what, schooling for their kids, and there was a lot of stress and the health. So yes, just the health, physical health issues, right, of dealing with COVID. So there is a huge increase in mental health conditions since COVID. The numbers have increased. I don't know the specific stats though. Sorry about that. I don't know if you wanted to mention anything or not.
We operate as a two-board institution. One part of the institution belongs to the people who attend treatment, as well as those who don't attend our place but are welcome nonetheless. And we have a board of directors that's nothing but members of the community. And we have the power to do many things in the organization. We recommend actions to the other board. We also participate with them in decision-making as well. And it's about empowerment, and that we all want to be recognized as an equal part. And so we're able to do that with two boards.
Also, okay. I've never been prescribed to spend time at a psychiatric hospital. My mom and dad said, tough it out, tough it out. They just, it could be they couldn't afford to send me to a psychiatrist, but I would say that this has been unusual for me because I can influence how much medication maybe I can take. They'll say, well, a psychiatrist that we've had, he retired now, he said, well, you can maybe scale back down a little bit, and so now I use half a dose. So apparently I've had so much good therapy with him and the social worker person and the counselor person that I'm full-fledged into recovery now. It's almost like I maybe don't have as strong a mental illness. I mean, mental health has been my goal.
As COVID-related programming, I know I wasn't here, but just looking at what we did and reading reports, we delivered food. We did do some telehealth, but the isolation part from what we do was also a big barrier, and then also getting people back in for programming, over the last year and a half has been a bit challenging because, now people are afraid to come out, or are we still doing the same type of programming that we were doing prior to COVID? So all of those things, I know prior to me coming, they did a fundraising event that was kind of virtual, which is a little different thing, so now we're doing more, in-person events now. But even with that, you still have some of the layers of why people may not participate because of the COVID pandemic.
I'm not crazy, I'm just a little not well. I know right now you can't tell, but stay a while and then you'll see how I used to be. You know that song?
Yeah, you sound a little different though. This is good though.
My question, and more importantly, concerns youth. I deal with a lot of youth gang violence, gun violence. Is anyone at Heartland dealing with the young people and the gang and fighting and shooting at all?
That's a good question. So we don't deal with youth as part of our program. With the shooting they had at the high school, kind of prior to me coming, it was like maybe 3 months after, I got a call from the Denver Public School District, can we be a provider for the Denver Public Schools, okay? And I said, yes, we can for adults. So we have that kind of layer approach that, what we can do, what we can't do. So as far as when that situation occurred with the shooting, we can see anybody, but typically we right now we're only seeing adults 18 and older. But I feel you, I understand. Youth, I get it. Working with youth, I totally get it, that they need the supportive services. But more importantly, sometimes, their parents need it. You know what I mean? Their parents need it. And I think sometimes how we look at this, it's an internal structure of family functioning. You know, and sometimes the only way you're going to make a change is if you get the people that make the decisions in the household, and those should be the parents. So, but we do serve adults.
Thank you all for asking some questions.
Let's thank our guests today. This is great. Thank you. Thank you so much. We have 3 more weeks, and just to give an overview, and I want you to talk. Could you come up here, Mary Jo, real quick? Next week is Dr. Margie Lewis. She's a therapist and a mental health expert. She's going to be talking about adverse impacts of trauma on a person's life, contrasting mental illness and personality disorders, treating reversible and irreversible conditions, and facilitating change in behavior, and the importance, her view and the importance of spirituality in treating mental disorders. The reason I'm sharing these things is because there's going to be plenty of time for questions. So if we don't get all your questions answered today, they'll be answered over 4 weeks. And do you want to talk about, Mary Jo, the March 10th?
Malcolm, you have to come back on the 10th. Jenna Glover is really an expert in children and teens and mental health. So I've interviewed her when I was a reporter. She's fantastic. She's really good about talking about how much COVID, what a negative impact COVID has had on children and teens. And also she talks a lot about social media and kind of how parents can help navigate that to help their kids. So definitely come back on March 10th.
Thank you so much. The last session will be some sharing on depression, particular stories on depression, how serious mental illness has affected one family, and how that family, happens to be my family, has dealt with that. And then there's going to be some talk on suicide prevention and that whole stigma of suicide and all that reality and that crisis in our society, and lots of time for questions. So we thank you for being here, and we'll see you next week. Thank you. Thank you.